Hello, nursing students. Welcome to Nursing Exam Preparation, your go-to resource for mastering nursing exams with confidence. In today's video, we'll take you through 120 multiple-choice questions, MCQs, focused on prioritization and delegation, one of the most crucial aspects of nursing practice. Each question is carefully crafted to test your knowledge, sharpen your skills, and enhance your understanding of prioritization and delegation. Detailed explanations follow every question to help you not only identify the correct answers, but also understand the rationale behind them. Whether you're just starting your studies or preparing for exams, this video is packed with valuable content to boost your critical thinking and decision-making skills. Make sure to like, share, and subscribe to Nursing Exam Preparation for even more helpful resources. Don't forget to tap the bell icon so you'll never miss an update. We're here to support your journey to success with fresh, engaging content. Once you've completed the quiz, let us know how you scored in the comments below. We'd love to hear from you. Now, let's get started and take one step closer to acing your nursing exams and achieving your goals. 1. A nurse is caring for 4 patients. Which patient should the nurse prioritize for immediate assessment? A. A patient with stable vital signs post-surgery. B. A patient with a chest wound and diminished breath sounds. C. A patient with a history of hypertension and a headache. D. A patient with a low-grade fever and a cough. Answer: B. A patient with a chest wound and diminished breath sounds. Rationale: the patient with a chest wound and diminished breath sounds, option B, should be prioritized as they may be experiencing a pneumothorax or another life-threatening complication. Option A is stable. Option C's headache may be a concern but is not immediately critical, and option D's symptoms are not acute or life-threatening. 2. The nurse is delegating tasks to a nursing assistant. Which of the following tasks is appropriate for delegation? A. Administering a blood transfusion to a patient with anemia. B. Assessing a patient's neurological status after stroke. C. Measuring a patient's vital signs and weight. D. Performing a thorough assessment of a wound infection. Answer: C. Measuring a patient's vital signs and weight. Rationale: measuring vital signs and weight, option C, is within the scope of practice for a nursing assistant. Administering a blood transfusion, option A, and performing complex assessments, options B and D, require the skills and knowledge of a registered nurse. 3. A nurse is considering delegation to a licensed practical nurse, LPN. Which task can the LPN safely perform? A. Initiating an intravenous 4 line in an adult patient. B. Administering a blood transfusion to a pediatric patient. C. Teaching a newly diagnosed diabetic patient how to manage their condition. D. Administering oral medications and performing wound care for stable patients. Answer: D. Administering oral medications and performing wound care for stable patients. Rationale: LPNs are trained to administer medications and perform basic wound care for stable patients, option D. For initiation, option A, and blood transfusions, option B, may require more advanced training or supervision. Teaching patients, option C, is typically done by a registered nurse, as it requires comprehensive patient education. 4. A nurse is caring for a patient who is post-surgery and has a history of asthma. The nurse receives a report from the night shift that the patient's oxygen saturation is 90%. What should the nurse do first? A. Administer a dose of pain medication to help the patient relax. B. Notify the physician about the patient's oxygen saturation. C. Increase the oxygen flow rate and reassess the patient's status. D. Have the patient use the incentive spirometer to improve lung expansion. Answer: C. Increase the oxygen flow rate and reassess the patient's status. Rationale: the priority action is to increase oxygen flow, option C, to address potential hypoxia, which could be exacerbated by the patient's asthma. Pain medication, option A, may be appropriate, but does not address the immediate concern. Notifying the physician, option B, and using the incentive spirometer, option D, are important, but these actions should come after ensuring adequate oxygenation. 5. The nurse is delegating tasks to a team of healthcare workers. Which of the following is an example of improper delegation? A is assigning a CNA to monitor a patient's blood pressure and report any changes. B. Asking an RN to perform a comprehensive health assessment on a new patient. C. Delegating medication administration to a LPN in a stable patient. D. Asking an unlicensed assistive personnel, UAP, to administer oral medication to a patient. Answer: D. Asking an unlicensed assistive personnel, UAP, to administer oral medication to a patient. Rationale: asking a UAP, option D, to administer medication is inappropriate, as UAPs cannot administer medications. Option A is appropriate for a CNA, and options B and C are appropriate tasks for RNs and LPNs, respectively. 6. A nurse is caring for 4 patients. Which patient should the nurse assess first? A. A patient with a blood pressure of 110/70 mmHg after receiving antihypertensive medication. B. A patient with a pulse rate of 120 beats per minute postoperative. C. A patient with a pain score of 5 out of 10 after surgery. D. A patient with a blood sugar level of 150 milligrams per deciliter before a meal. Answer: B. A patient with a pulse rate of 120 beats per minute postoperative. Rationale: a postoperative patient with a tachycardic pulse, option B, requires immediate assessment to rule out complications such as hemorrhage or infection. The other options are stable and do not require urgent attention. Option A is within normal limits. Option C's pain score can be managed, and option D's blood sugar level is elevated but not critically high. 7. The nurse is delegating tasks to a nursing assistant. Which of the following tasks can the nursing assistant perform independently? A. To perform a physical assessment of a patient's lung sounds. B. Assist a patient with feeding and positioning in bed. C. Administer 4 medications. D. Teach a patient how to use a walker. Answer: B. Assist a patient with feeding and positioning in bed. Rationale: assisting with activities of daily living such as feeding and positioning, option B, is appropriate for a nursing assistant. Performing a physical assessment, option A, administering medications, option C, and teaching a patient, option D, are tasks that require the clinical judgment and training of a registered nurse. 8. A nurse is caring for a patient who is postoperative and has a surgical wound. The nurse notices that the wound is red, swollen, and oozing yellow drainage. What should the nurse do first? A. Reposition the patient to improve circulation to the area. B. Notify the healthcare provider immediately. C. Apply a clean dressing to the wound. D. Continue to monitor the wound for signs of improvement. Answer: B. Notify the healthcare provider immediately. Rationale: the wound is showing signs of infection, redness, swelling, and yellow drainage, so the nurse should notify the healthcare provider immediately, option B. Repositioning, option A, may be helpful later, but immediate medical intervention is necessary. Applying a dressing, option C, and continuing to monitor, option D, are appropriate later, but not immediately. 9. The nurse is delegating care to an unlicensed assistive personnel, UAP. Which task is appropriate for the UAP to perform? A. Administering an intramuscular injection. B. Assisting a patient with activities of daily living, ADLs. C. Monitoring a patient for signs of postoperative complications. D. Performing a neurological assessment on a stroke patient. Answer: B. Assisting a patient with activities of daily living, ADLs. Rationale: assisting with ADLs, option B, is within the scope of practice for a UAP. Administering injections, option A, monitoring post-operative complications, option C, and performing neurological assessments, option D, require the expertise of a registered nurse or licensed professional. 10. A nurse is caring for a patient who is having difficulty breathing. The nurse determines that the patient needs immediate suctioning of the airway. Which action should the nurse take next? A. Notify the healthcare provider immediately. B. Prepare the suction equipment and suction the patient's airway. C. Increase the oxygen flow rate and assess the patient's breathing. D. Check the patient's respiratory rate and reassess in 15 minutes. Answer: B. Prepare the suction equipment and suction the patient's airway. Rationale: the nurse should prepare the suction equipment and suction the patient's airway, option B, as this is the immediate action required to help clear the airway. Notifying the provider, option A, is important, but not the priority. Increasing oxygen flow, option C, can be done after the airway is cleared and waiting, option D, is not appropriate in an emergency. 11. A nurse is caring for a post-operative patient with a drainage tube in place. Which of the following actions is the nurse responsible for? A. Emptying the drainage device and measuring the output. B. Replacing the drainage tube. C. Teaching the patient how to care for the drain at home. D. Inserting the drainage tube if it becomes displaced. Answer: A. Emptying the drainage device and measuring the output. Rationale: the nurse is responsible for emptying the drainage device and measuring the output, option A. Replacing or inserting the drainage tube, options B and D, would be done by a physician or surgeon. Teaching the patient to care for the drain, option C, is important but is not the immediate task the nurse is responsible for. 12. The nurse is caring for a patient who is receiving 4 antibiotics. The patient begins to experience itching and hives. What is the nurse's first action? A. Notify the healthcare provider about the reaction. B. Discontinue the antibiotic infusion immediately. C. Administer an antihistamine to alleviate the symptoms. D. Document the allergic reaction in the patient's chart. Answer: B. Discontinue the antibiotic infusion immediately. Rationale: the first action is to discontinue the antibiotic infusion, option B, to prevent further exposure to the allergen. Notifying the healthcare provider, option A, should follow, but immediate intervention is needed. Administering an antihistamine, option C, and documenting, option D, are important, but they are secondary to stopping the offending medication. 13. The nurse is delegating tasks to a licensed practical nurse, LPN. Which of the following tasks is appropriate for the LPN to perform? A. To perform an admission assessment on a new patient. B. Monitor a patient who is receiving a blood transfusion. C. Administer 4 antibiotics to a stable patient. D. Develop a care plan for a newly admitted patient. Answer: B. Monitor a patient who is receiving a blood transfusion. Rationale: LPNs are trained to monitor stable patients receiving blood transfusions, option B. Administering 4 antibiotics, option C, is often outside of an LPN's scope depending on the state regulations. Performing assessments and developing care plans, options A and D, require the clinical expertise of a registered nurse. 14. A nurse is caring for a patient who has just been admitted with acute chest pain. The nurse must determine which interventions to perform first. Which intervention should the nurse prioritize? A. Administering pain medication as ordered. B. Placing the patient in a semi-Fowler's position to aid breathing. C. Obtaining an ECG to assess for possible myocardial infarction. D. Assessing the patient's vital signs and oxygen saturation. Answer: D. Assessing the patient's vital signs and oxygen saturation. Rationale: the first priority is to assess the patient's vital signs and oxygen saturation, option D, to determine the severity of the chest pain and possible complications. Administering pain medication, option A, and placing the patient in a semi-Fowler's position, option B, are important but secondary. An ECG, option C, should follow to evaluate for myocardial infarction. 15. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD. The nurse notices that the patient is becoming increasingly short of breath. What should the nurse do first? A. Encourage the patient to cough and deep breathe. B. Increase the oxygen flow rate and assess the patient's lung sounds. C. Administer a bronchodilator as ordered. D. Notify the healthcare provider about the patient's condition. Answer: B. Increase the oxygen flow rate and assess the patient's lung sounds. Rationale: the first action should be to increase the oxygen flow rate and assess lung sounds, option B, to address potential hypoxia. Encouraging coughing, option A, may help clear the airways, but it does not address the immediate concern. Administering a bronchodilator, option C, and notifying the healthcare provider, option D, should follow after assessing the situation. 16. The nurse is delegating care to a team of healthcare workers. Which of the following tasks can be delegated to an unlicensed assistive personnel, UAP? A. Administering medication to a patient. B. Assisting a patient with bathing and grooming. C. Performing a sterile dressing change, for a surgical wound. D. Assessing a patient's neurological status after a stroke. Answer. B. Assisting a patient with bathing and grooming. Rationale. Assisting with activities of daily living such as bathing and grooming, option B, is within the scope of practice for a UAP. Administering medications, option A. Performing sterile dressing changes, option C, and assessing a patient's neurological status, option D, require more advanced clinical training and should be performed by an RN or LPN. 17. A nurse is caring for a patient with severe burns. The patient is being prepared for transfer to the burn unit. Which of the following actions is the nurse responsible for before transfer? A. Administering a blood transfusion as ordered. B. Ensuring that the patient's vital signs are stable. C. Performing a full physical assessment of the patient. D. Teaching the patient about post-burn care. Answer. B. Ensuring that the patient's vital signs are stable. Rationale. Ensuring that the patient's vital signs are stable, option B, is the priority before transfer to the burn unit. Administering a blood transfusion, option A, and performing a full assessment, option C, are important, but stability must be confirmed first. Teaching the patient, option D, is important but can be done after the transfer or later during recovery. 18. The nurse is caring for a patient with a nasogastric NG tube in place. The patient is not tolerating tube feedings and begins to vomit. What should the nurse do first? A. Notify the healthcare provider about the vomiting. B. Remove the NG tube immediately. C. Elevate the head of the bed to prevent aspiration. D. Check the NG tube placement to ensure it is correctly positioned. Answer. C. Elevate the head of the bed to prevent aspiration. Rationale. Elevating the head of the bed, option C, is the first action to prevent aspiration, which can be life-threatening. Notifying the provider, option A, and removing the NG tube, option B, should be done afterward. Checking tube placement, option D, is essential if vomiting persists, but elevating the bed is the priority. 19. A nurse is caring for a patient post-surgery who is experiencing pain. The patient is requesting pain medication. What is the nurse's first action? A. Administer the prescribed pain medication. B. Assess the patient's pain level and vital signs. C. Notify the healthcare provider for stronger pain medication. D. Teach the patient relaxation techniques for pain management. Answer. B. Assess the patient's pain level and vital signs. Rationale. The first action is to assess the patient's pain level and vital signs, option B, to determine the severity of pain and any contraindications for medication. Administering medication, option A, may be appropriate, but assessment is necessary first. Notifying the provider, option C, and teaching relaxation techniques, option D, are secondary actions based on the assessment. 20. The nurse is caring for a patient with diabetes who is experiencing hypoglycemia. What should the nurse do first? A. Administer an oral dose of fast-acting carbohydrate, such as orange juice. B. Notify the healthcare provider about the hypoglycemia. C. Administer insulin to correct the elevated blood glucose level. D. Check the patient's blood glucose level to confirm hypoglycemia. Answer. A. Administer an oral dose of fast-acting carbohydrate, such as orange juice. Rationale. The first action is to administer fast-acting carbohydrate, option A, to raise the patient's blood glucose level. Notifying the healthcare provider, option B, is important but not the priority. Administering insulin, option C, is not appropriate in hypoglycemia. Checking the blood glucose level, option D, is essential but should be done after the patient is treated with carbohydrates if the diagnosis of hypoglycemia is clear. 21. A nurse is caring for a patient who has been admitted with severe anxiety. The patient is asking for a sedative to help them relax. What is the nurse's first action? A. Administer the prescribed sedative medication. B. Assess the patient's anxiety level and coping mechanisms. C. Offer the patient distraction techniques such as guided imagery. D. Notify the healthcare provider for further medication orders. Answer. B. Assess the patient's anxiety level and coping mechanisms. Rationale. The nurse should assess the patient's anxiety level and coping mechanisms, option B, to determine the most appropriate intervention. Administering sedatives, option A, should be based on assessment, not the first action. Offering distraction techniques, option C, may help, but first, the nurse should understand the patient's anxiety level. Notifying the healthcare provider, option D, is not necessary unless the patient's condition worsens. 22. The nurse is caring for a patient who has developed a deep vein thrombosis, DVT, after surgery. Which action should the nurse take first? A. Apply compression stockings to the patient's legs. B. Elevate the patient's legs to reduce swelling. C. Notify the healthcare provider about the new development. D. Administer the prescribed anticoagulant medication. Answer. C. Notify the healthcare provider about the new development. Rationale. The first priority is to notify the healthcare provider, option C, to determine the course of action for treating the DVT. Applying compression stockings, option A, and elevating the legs, option B, may help but are not as critical as informing the provider. Administering anticoagulants, option D, may be necessary but should be done after the provider's orders. 23. A nurse is caring for a postoperative patient who is showing signs of infection at the surgical site. What should the nurse do first? A. Notify the healthcare provider and prepare for possible culture. B. Apply a clean dressing and monitor the site for further changes. C. Assess the wound for signs of infection and document findings. D. Administer prescribed antibiotics as ordered. Answer. C. Assess the wound for signs of infection and document findings. Rationale. The nurse must first assess the wound, option C, for signs of infection such as redness, swelling, and discharge. Once this is done, documentation and communication with the healthcare provider, option A, can follow. Applying a clean dressing, option B, and administering antibiotics, option D, are important, but assessment is the priority. 24. The nurse is assigned to care for 4 patients. Which patient should the nurse prioritize for assessment? A. A patient who is 12 hours post-surgery with stable vital signs. B. A patient with a history of asthma who is experiencing mild shortness of breath. C. The patient with diabetes who has a blood glucose level of 250 milligrams per deciliter. D. A patient who is 3 hours post-surgery with a temperature of 101 degrees Fahrenheit 38.3 degrees Celsius. Answer. D. A patient who is 3 hours post-surgery with a temperature of 101 degrees Fahrenheit 38.3 degrees Celsius. Rationale. A post-operative patient with a fever, option D, is at risk for infection and requires immediate assessment. The other patients have stable conditions. Option A is stable, option B is mild and manageable, and option C's blood glucose level is elevated but not critically high. 25. The nurse is caring for a patient who is exhibiting signs of respiratory distress. What should the nurse do first? A. Administer oxygen via nasal cannula, as prescribed. B. Notify the healthcare provider about the patient's condition. C. Elevate the head of the bed to improve breathing. D. Assess the patient's lung sounds and oxygen saturation. Answer. D. Assess the patient's lung sounds and oxygen saturation. Rationale. The first action is to assess the patient's lung sounds and oxygen saturation, option D, to determine the severity of the respiratory distress. Administering oxygen, option A, and notifying the provider, option B, are important, but assessment must be done first. Elevating the head of the bed, option C, may help, but it's secondary to assessing the situation. 26. A nurse is caring for a patient with a heart rate of 140 beats per minute and a blood pressure of 90/50 millimeter of mercury. What is the nurse's priority action? A. Administer a dose of beta blockers as prescribed. B. Increase the patient's 4 fluids to improve perfusion. C. Notify the healthcare provider immediately. D. Perform a 12-lead ECG to assess the patient's cardiac rhythm. Answer. B. Increase the patient's 4 fluids to improve perfusion. Rationale. The priority action is to increase the patient's 4 fluids, option B, to improve perfusion and stabilize the low blood pressure. Administering beta blockers, option A, could further decrease the heart rate and BP, which is not appropriate at this time. Notifying the provider, option C, and performing an ECG, option D, are important, but the immediate intervention is fluid resuscitation. 27. The nurse is caring for a patient who is receiving a blood transfusion. The nurse notices the patient is becoming anxious and is experiencing a low-grade fever. What should the nurse do first? A. Stop the transfusion and monitor for signs of an allergic reaction. B. Notify the healthcare provider immediately and prepare for further interventions. C. Assess the patient's vital signs and recheck the transfusion rate. D. Administer an antipyretic medication as ordered. Answer. C. Assess the patient's vital signs and recheck the transfusion rate. Rationale. The first step is to assess the patient's vital signs, option C, to determine if the fever and anxiety are related to the transfusion. Stopping the transfusion, option A, may be necessary, but assessment is required first. Notifying the healthcare provider, option B, and administering antipyretics, option D, may be needed based on the assessment, but they are not the first actions. 28. The nurse is preparing to discharge a patient who has just been diagnosed with hypertension. What should the nurse prioritize in the discharge teaching? A. Providing information about diet and exercise to manage blood pressure. B. Teaching the patient how to monitor their blood pressure at home. C. Explaining the potential complications of untreated hypertension. D. Reviewing the prescribed medication regimen and potential side effects. Answer. D. Reviewing the prescribed medication regimen and potential side effects. Rationale. The nurse should prioritize reviewing the patient's medication regimen, option D, to ensure the patient understands how to take the medications and any potential side effects. Teaching about diet and exercise, option A, and blood pressure monitoring, option B, are also important but secondary. Explaining complications, option C, is also necessary, but medication education is more urgent for adherence. 29. The nurse is caring for a patient who is exhibiting signs of delirium. What is the nurse's first priority? A. Administering a sedative to calm the patient. B. Ensuring the patient is in a safe environment to prevent injury. C. Notifying the healthcare provider about the patient's condition. D. Providing the patient with fluids and nourishment. Answer. B. Ensuring the patient is in a safe environment to prevent injury. Rationale. The first priority is ensuring the patient is in a safe environment to prevent injury, option B. Administering sedatives, option A, is not appropriate unless the patient's safety is ensured. Notifying the provider, option C, and providing fluids, option D, are important but secondary to patient safety in delirium. 30. The nurse is preparing to delegate a task to a nursing assistant. Which of the following tasks is appropriate to delegate to the nursing assistant? 8. Performing a sterile dressing change on a postoperative wound. B. Assisting with the patient's mobility and helping them to the bathroom. C. Administering a prescribed antibiotic to a patient with pneumonia. D. Monitoring the patient's level of consciousness after a head injury. Answer. B. Assisting with the patient's mobility and helping them to the bathroom. Rationale. Assisting with mobility and helping with toileting, option B, is within the scope of practice for a nursing assistant. Performing sterile dressing changes, option A, and administering medications, option C, require nursing knowledge and skills. Monitoring neurological status, option D, requires clinical judgment and should be done by a registered nurse. 31. A nurse is caring for a patient who is experiencing acute pain. What should the nurse do first to address the patient's pain? A. Administer prescribed pain medication as ordered. B. Assess the patient's pain level using a pain scale. C. Provide the patient with relaxation techniques to help manage pain. D. Notify the healthcare provider about the need for pain management. Answer. B. Assess the patient's pain level using a pain scale. Rationale. The first step in addressing pain is to assess the patient's pain level, option B, using a standardized pain scale. Administering pain medication, option A, should follow after the assessment. Providing relaxation techniques, option C, can be an adjunct, but pain severity must be assessed first. Notifying the healthcare provider, option D, may be necessary for additional orders if pain is severe. 32. The nurse is caring for a patient who is receiving continuous fluids. The nurse notices that the site is red and swollen. What should the nurse do first? A. Increase the infusion rate to flush the line. B. Discontinue the infusion and remove the catheter. C. Notify the healthcare provider about the situation. D. Apply a warm compress to the foresight. Answer. B. Discontinue the infusion and remove the catheter. Rationale. The first priority is to discontinue the infusion and remove the catheter. Option B. To prevent further complications such as infiltration or infection. Increasing the infusion rate, option A, is inappropriate as it could exacerbate the situation. Notifying the provider, option C, is necessary, but the immediate action is to stop the infusion. Applying a warm compress, option D, may help afterward, but is not the priority. 33. The nurse is caring for a patient who is post-operative and has a wound that appears to be healing slowly. What should the nurse do first? A. Apply an antiseptic ointment to the wound to prevent infection. B. Assess the patient's nutritional status to ensure adequate healing. C. Notify the healthcare provider about the slow healing wound. D. Reposition the patient to relieve pressure on the wound. Answer. B. Assess the patient's nutritional status to ensure adequate healing. Rationale. The nurse should first assess the patient's nutritional status, option B, as proper nutrition is essential for wound healing. Applying ointment, option A, is not the priority and may not address the underlying issue. Notifying the provider, option C, is important but should come after assessing the patient's status. Repositioning the patient, option D, may be necessary later, but is not the first priority. 34. A nurse is caring for a patient who has just been admitted to the emergency department with a suspected myocardial infarction, MI. What should the nurse do first? A. Administer nitroglycerin to relieve chest pain. B. Obtain an electrocardiogram, ECG, to assess heart activity. C. Start an intravenous, line for medication administration. D. Assess the patient's pain level and oxygen saturation. Answer. D. Assess the patient's pain level and oxygen saturation. Rationale. The first priority is to assess the patient's pain level and oxygen saturation, option D, to evaluate the severity of the MI and the patient's respiratory status. Administering nitroglycerin, option A, and starting in line, option C, are important but should follow after assessment. Obtaining an ECG, option B, is essential but secondary to initial patient evaluation. 35. A nurse is delegating tasks to an unlicensed assistive personnel, UAP. Which of the following tasks can the UAP perform? A. Perform a blood draw for laboratory testing. B. Check a patient's blood pressure and temperature. C. Administer oral medications as prescribed. D. Monitor a patient's oxygen saturation level after surgery. Answer. B. Check a patient's blood pressure and temperature. Rationale. Checking a patient's vital signs, including blood pressure and temperature, option B, is within the scope of practice for a UAP. Performing a blood draw, option A, administering medications, option C, and monitoring oxygen saturation, option D, require more advanced clinical skills and should be performed by a registered nurse or licensed practical nurse. 36. A nurse is caring for a patient who is post-operative and experiencing nausea. What should the nurse do first? A. Administer the prescribed antiemetic medication. B. Position the patient in a comfortable position and assess for other symptoms. C. Notify the healthcare provider about the patient's symptoms. D. Offer the patient clear fluids to prevent dehydration. Answer. B. Position the patient in a comfortable position and assess for other symptoms. Rationale. The first priority is to ensure the patient is in a comfortable position and assess other symptoms, option B, to determine the cause of nausea and potential interventions. Administering antiemetic medication, option A, may be appropriate but should follow after assessing the patient. Notifying the provider, option C, and offering fluids, option D, are secondary actions after initial assessment. 37. A nurse is caring for a patient who is receiving morphine for pain control. The nurse notices the patient's respiratory rate has decreased to 8 breaths per minute. What should the nurse do first? A. Administer naloxone Narcan to reverse the opioid effects. B. Notify the healthcare provider immediately about the respiratory depression. C. Increase the oxygen flow rate to the patient's mask. D. Assess the patient's level of consciousness and pain. Answer. A. Administer naloxone Narcan to reverse the opioid effects. Rationale. The priority in this case is to reverse the opioid-induced respiratory depression with naloxone, option A. Notifying the provider, option B, is important but secondary to the immediate action of administering naloxone. Increasing oxygen flow, option C, can be done afterward, and assessing consciousness and pain, option D, is necessary, but the priority is to address the respiratory depression. 38. A nurse is caring for a patient who is experiencing an anaphylactic reaction after receiving a medication. What should the nurse do first? A. Administer epinephrine as ordered. B. Call a rapid response team for assistance. C. Assess the patient's airway, breathing, and circulation, ABCs. D. Notify the healthcare provider immediately. Answer. C. Assess the patient's airway, breathing, and circulation, ABCs. Rationale. The first priority in an anaphylactic reaction is to assess the patient's ABCs, airway, breathing, and circulation. Option C, to determine the severity of the reaction. Administering epinephrine, option A, is critical but should follow after assessment. Calling the rapid response team, option B, and notifying the provider, option D, are important but should occur after ensuring patient stability. 39. The nurse is caring for a postoperative patient with a wound drain. The nurse notices the patient is experiencing excessive drainage. What should the nurse do first? A. Reposition the patient to reduce pressure on the wound. B. Empty the drain and measure the amount of output. C. Notify the healthcare provider about the increased drainage. D. Apply a new dressing to the wound to prevent infection. Answer. B. Empty the drain and measure the amount of output. Rationale. The first action is to empty the wound drain and measure the output, option B, to assess the volume of drainage and determine if it is within normal limits. Repositioning the patient, option A, may help, but it is secondary. Notifying the provider, option C, is necessary but not until the nurse has gathered information. Applying a new dressing, option D, is important but can follow after emptying and assessing the drain. 40. A nurse is caring for a patient who is being discharged with a new diagnosis of heart failure. What should the nurse prioritize in discharge teaching? A. Teaching the patient about dietary restrictions and low-sodium foods. B. Explaining the importance of weight monitoring and when to call the healthcare provider. C. Teaching the patient how to monitor blood pressure and take medications as prescribed. D. Discussing the potential for future hospitalizations and treatment options. Answer. B. Explaining the importance of weight monitoring and when to call the healthcare provider. Rationale. The priority in heart failure teaching is to explain the importance of daily weight monitoring and when to contact the healthcare provider, option B, as sudden weight gain can indicate fluid retention. Teaching about dietary restrictions, option A, monitoring blood pressure, option C, and discussing future hospitalizations, option D, are also important but secondary to weight monitoring. 41. The nurse is caring for a patient with a history of seizures who is currently experiencing a tonic-clonic seizure. What is the nurse's first action? A. Place the patient in a side-lying position to prevent aspiration. B. Administer the prescribed anticonvulsant medication. C. Protect the patient from injury by clearing the area of sharp objects. D. Call the healthcare provider for instructions on managing the seizure. Answer. C. Protect the patient from injury by clearing the area of sharp objects. Rationale. The first priority is to protect the patient from injury by clearing the area, option C. Placing the patient in a side-lying position, option A, should be done after ensuring the patient's safety. Administering anticonvulsant medication, option B, is important but secondary, and calling the provider, option D, is unnecessary unless the seizure continues longer than expected. 42. A nurse is caring for a patient who is receiving a blood transfusion. The nurse notices the patient has developed a rash and itching. What should the nurse do first? A. Stop the transfusion immediately and monitor the patient for further symptoms. B. Administer an antihistamine to relieve the itching. C. Notify the healthcare provider immediately about the reaction. D. Continue the transfusion and observe the patient for further symptoms. Answer. A. Stop the transfusion immediately and monitor the patient for further symptoms. Rationale. The first action in this case is to stop the transfusion immediately, option A, because the patient may be having an allergic reaction. Administering antihistamines, option B, can help alleviate symptoms, but the transfusion should be stopped first. Notifying the provider, option C, is essential but should follow after stopping the transfusion. Continuing the transfusion, option D, could worsen the reaction. 43. The nurse is preparing to delegate tasks to a nursing assistant. Which of the following tasks is appropriate for delegation to the nursing assistant? A. Taking a complete health history from a new patient. B. Monitoring a patient's vital signs after surgery. C is performing a physical assessment of a patient with chest pain. D. Administering intravenous fluids to a patient in the ICU. Answer: B. Monitoring a patient's vital signs after surgery. Rationale: monitoring vital signs, option B, is within the scope of practice for a nursing assistant. Taking a health history, option A, performing a physical assessment, option C, and administering intravenous fluids, option D, require the expertise of a registered nurse or a licensed practical nurse. 44. A nurse is caring for a patient who has just been diagnosed with cancer and is exhibiting signs of emotional distress. What should the nurse do first? A. Administer an anxiolytic medication as prescribed. B. Listen to the patient's concerns and provide emotional support. C. Notify the healthcare provider for further intervention. D. Encourage the patient to participate in relaxation exercises. Answer: B. Listen to the patient's concerns and provide emotional support. Rationale: the first priority is to listen to the patient's concerns and provide emotional support, option B, to help the patient cope with the diagnosis. Administering medication, option A, may be appropriate, but emotional support is the first step. Notifying the provider, option C, may be necessary for further interventions, but patient support should be prioritized first. Encouraging relaxation exercises, option D, is helpful, but it should follow after addressing emotional needs. 45. The nurse is caring for a patient who is receiving oxygen therapy. The patient begins to exhibit confusion and restlessness. What should the nurse do first? A. Increase the oxygen flow rate to improve oxygenation. B. Notify the healthcare provider about the patient's condition. C. Assess the patient's oxygen saturation level and respiratory status. D. Administer a sedative to help calm the patient. Answer: C. Assess the patient's oxygen saturation level and respiratory status. Rationale: the first step is to assess the patient's oxygen saturation level and respiratory status, option C, to identify any respiratory compromise. Increasing the oxygen flow, option A, may be necessary, but the nurse needs to assess the situation first. Notifying the provider, option B, is important, but the priority is initial assessment. Administering a sedative, option D, would not be appropriate in a patient with respiratory distress. 46. The nurse is caring for a postoperative patient who has a urinary catheter in place. The nurse notes that the urine output has decreased significantly. What should the nurse do first? A. Flush the catheter with sterile saline to ensure patency. B. Check the patient's vital signs and report changes to the healthcare provider. C. Increase the fluid rate to improve urine output. D. Assess the bladder for distension and palpate for fullness. Answer: B. Check the patient's vital signs and report changes to the healthcare provider. Rationale: decreased urine output could indicate potential complications, such as shock or acute kidney injury. The first priority is to check the patient's vital signs, option B, and report changes to the healthcare provider. Flushing the catheter, option A, and increasing the flow rate, option C, may be necessary, but the patient's overall status must be assessed first. Palpating the bladder, option D, may be helpful but should be secondary to vital sign assessment. 47. The nurse is caring for a patient who has developed a pressure ulcer on their sacral region. What should the nurse do first? A. Apply a hydrocolloid dressing to the wound. B. Reposition the patient to relieve pressure on the area. C. Notify the healthcare provider about the pressure ulcer. D. Clean the wound with antiseptic solution and assess the size. Answer: B. Reposition the patient to relieve pressure on the area. Rationale: the first priority is to reposition the patient to relieve pressure on the area, option B, to prevent further tissue damage. Applying a dressing, option A, and notifying the provider, option C, may be necessary but are secondary to pressure relief. Cleaning the wound, option D, should occur after repositioning to ensure that the ulcer does not worsen. 48. The nurse is caring for a patient who has an order for a wound dressing change. The nurse notices that the patient has an elevated white blood cell, WBC count. What should the nurse do first? A. Change the dressing as ordered. B. Assess the wound for signs of infection, such as redness, warmth, or drainage. C. Notify the healthcare provider about the elevated WBC count. D. Administer prescribed antibiotics to treat the potential infection. Answer. B. Assess the wound for signs of infection, such as redness, warmth, or drainage. Rationale. The nurse should first assess the wound for signs of infection, option B, because an elevated WBC count may indicate infection. Changing the dressing, option A, and notifying the provider, option C, are important but should follow after the wound is assessed. Administering antibiotics, option D, may be necessary but should be done after assessment and with provider approval. 49. The nurse is preparing to delegate a task to a nursing assistant. Which of the following tasks is appropriate for delegation to the nursing assistant? A. Administering a subcutaneous injection to a diabetic patient. B. Taking the patient's blood pressure and assisting with morning hygiene. C. Assessing the patient's respiratory status following surgery. D. Performing a physical assessment of a patient's neurological function. Answer. B. Taking the patient's blood pressure and assisting with morning hygiene. Rationale. Taking vital signs, option B, and assisting with hygiene are appropriate tasks for a nursing assistant. Administering injections, option A. Assessing respiratory status, option C, and performing a neurological assessment, option D, require nursing judgment and expertise, which are outside the scope of practice for a nursing assistant. 50. The nurse is caring for a patient who has just been diagnosed with diabetes mellitus. What should the nurse prioritize in patient education? A. Teaching the patient how to monitor blood glucose levels. B. Discussing the potential long-term complications of diabetes. C. Explaining the importance of a low-sodium diet in managing diabetes. D. Teaching the patient how to administer insulin injections. Answer. A. Teaching the patient how to monitor blood glucose levels. Rationale. The most critical aspect of diabetes management is teaching the patient how to monitor their blood glucose levels, option A, to prevent hyperglycemia or hypoglycemia, while discussing long-term complications, option B, and teaching about insulin administration, option D, are important. They are secondary to blood glucose monitoring. Explaining a low-sodium diet, option C, is important but not as urgent as glucose management. 51. A nurse is caring for a patient who is experiencing acute chest pain. What should the nurse do first? A. Administer oxygen to the patient via nasal cannula. B. Obtain a 12-lead electrocardiogram, ECG, to assess heart function. C. Administer aspirin as prescribed to prevent clot formation. D. Assess the patient's pain level using a pain scale. Answer. D. Assess the patient's pain level using a pain scale. Rationale. The first step is to assess the patient's pain level using a pain scale, option D, to evaluate the severity of the chest pain. Administering oxygen, option A, and aspirin, option C, may be necessary but should be done after the pain assessment. Obtaining an ECG, option B, is also important but can follow after initial evaluation of the pain. 52. A nurse is preparing to delegate a task to a licensed practical nurse, LPN. Which task is appropriate for delegation to the LPN? A. It's assessing the mental status of a patient who is postoperative. B. Administering oral medications to a patient with stable vital signs. C. Performing a complete physical assessment of a patient with diabetes. D. Evaluating the results of laboratory tests in a newly admitted patient. Answer. B. Administering oral medications to a patient with stable vital signs. Rationale. Administering medications, option B, is within the scope of practice for a licensed practical nurse, LPN. Assessing mental status, option A. Performing a complete physical assessment, option C. And evaluating laboratory test results, option D, require a higher level of nursing judgment, which is typically outside the LPN's scope of practice. 53. The nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD, who is experiencing shortness of breath. What should the nurse do first? A. Administer bronchodilator medication as prescribed. B. Place the patient in a high Fowler's position to facilitate breathing. C. Assess the patient's oxygen saturation level and vital signs. D. Notify the healthcare provider about the patient's condition. Answer. C. Assess the patient's oxygen saturation level and vital signs. Rationale. The first step is to assess the patient's oxygen saturation level and vital signs, option C, to determine the severity of the respiratory distress. Administering bronchodilators, option A, and positioning the patient, option B, are important interventions, but they follow after assessment. Notifying the healthcare provider, option D, may be necessary, but initial assessment should be the priority. 54. The nurse is caring for a patient who is post-operative and is complaining of nausea and vomiting. What should the nurse do first? A. Administer an antiemetic medication as prescribed. B. Assess the patient's abdominal status and recent surgical history. C. Notify the healthcare provider about the patient's symptoms. D. Provide the patient with a warm compress to relieve nausea. Answer. B. Assess the patient's abdominal status and recent surgical history. Rationale. The first step is to assess the patient's abdominal status and recent surgical history, option B, to determine the cause of nausea and vomiting. Administering an antiemetic, option A, may be appropriate, but assessment is needed first. Notifying the provider, option C, may be necessary but should follow after assessment. Providing a warm compress, option D, can help but should not be the first action. 55. A nurse is caring for a patient with a newly diagnosed seizure disorder. What is the nurse's priority action in teaching the patient? A. Instruct the patient to keep a seizure log to document frequency and triggers. B. Explain the importance of taking anticonvulsant medications as prescribed. C. Discuss strategies for preventing injuries during a seizure, such as using a padded bed. D. Advise the patient to avoid driving until the seizures are well controlled. Answer. B. Explain the importance of taking anticonvulsant medications as prescribed. Rationale. The priority teaching for a patient with a seizure disorder is to explain the importance of adhering to the prescribed anticonvulsant regimen, option B. Keeping a seizure log, option A. Preventing injuries, option C. And advising against driving, option D, are important but secondary to medication adherence. 56. A nurse is caring for a patient who is experiencing respiratory distress. What should the nurse do first? A. Administer prescribed bronchodilators to open the airways. B. Assess the patient's respiratory rate, oxygen saturation, and lung sounds. C. Raise the head of the bed to facilitate breathing. D. Notify the healthcare provider about the patient's condition. Answer. B. Assess the patient's respiratory rate, oxygen saturation, and lung sounds. Rationale. The first priority is to assess the patient's respiratory rate, oxygen saturation, and lung sounds, option B, to determine the severity of respiratory distress. Administering bronchodilators, option A, and raising the head of the bed, option C, may be necessary, but assessment should be done first. Notifying the healthcare provider, option D, can be done after the assessment. 57. A nurse is caring for a patient who is post-operative and has developed a fever. What should the nurse do first? A. Administer an antipyretic medication as prescribed. B. Assess the patient's temperature and any other signs of infection. C. Notify the healthcare provider immediately about the fever. D. Provide a cold compress to the patient's forehead to reduce the fever. Answer. B. Assess the patient's temperature and any other signs of infection. Rationale. The first priority is to assess the patient's temperature and look for other signs of infection, option B, to understand the cause of the fever. Administering an antipyretic, option A, may be appropriate, but assessment should come first. Notifying the healthcare provider, option C, and providing a cold compress, option D, may be necessary but follow after assessment. 58. The nurse is preparing to discharge a patient who is newly diagnosed with hypertension. What should the nurse prioritize in discharge teaching? A. Instruct the patient on the importance of monitoring blood pressure regularly. B. Teach the patient about potential complications of untreated hypertension. C. Advise the patient to follow a low-fat diet to manage blood pressure. D. Explain the role of medication in controlling hypertension and the importance of adherence. Answer. D. Explain the role of medication in controlling hypertension and the importance of adherence. Rationale. The priority teaching for a patient with hypertension is explaining the role of medication and the importance of adherence. Option D. Monitoring blood pressure. Option A. Teaching about complications. Option B. And dietary changes. Option C. Are also important but secondary to medication adherence. 59. The nurse is caring for a patient who is receiving chemotherapy and is at risk for neutropenia. What should the nurse do first? A. Administer a growth factor injection to stimulate white blood cell production. B. Monitor the patient's temperature regularly for signs of infection. C. Instruct the patient to avoid large crowds and sick individuals. D. Ensure the patient's diet is high in protein and vitamins to support immune function. Answer. B. Monitor the patient's temperature regularly for signs of infection. Rationale. The first priority for a patient at risk for neutropenia is to monitor their temperature regularly. Option B. To detect any early signs of infection. Administering growth factor injections. Option A. And instructing the patient to avoid crowds. Option C. Are important but secondary to monitoring for infection. Ensuring a high-protein diet. Option D. May be helpful but should come after infection monitoring. 60. The nurse is caring for a patient with a history of falls. What should the nurse prioritize in the plan of care? A. Implement a fall prevention protocol, including the use of non-slip footwear. B. Provide a list of exercises to improve muscle strength. C. Educate the patient on the importance of taking medications on time. D. Instruct the patient to avoid all physical activity to reduce the risk of injury. Answer. A. Implement a fall prevention protocol, including the use of non-slip footwear. Rationale. The priority for a patient with a history of falls is implementing a fall prevention protocol. Option A. Such as using non-slip footwear and ensuring a safe environment. Providing exercises. Option B and medication education. Option C are important, but they should follow after addressing immediate fall risks. Instructing the patient to avoid physical activity. Option D could worsen their condition and is not recommended. 61. A nurse is caring for a patient who is receiving oxygen therapy and exhibits signs of agitation and confusion. What should the nurse do first? A. Increase the oxygen flow rate to improve oxygenation. B. Assess the patient's oxygen saturation level and respiratory status. C. Notify the healthcare provider about the patient's agitation. D. Administer a sedative to calm the patient. Answer. B. Assess the patient's oxygen saturation level and respiratory status. Rationale. The first action is to assess the patient's oxygen saturation and respiratory status. Option B. To identify whether hypoxia is causing the agitation. Increasing the oxygen flow. Option A may be necessary, but assessment should be done first. Notifying the provider. Option C can come after assessment. Administering a sedative. Option D is not appropriate when there is a possibility of hypoxia. 62. A nurse is caring for a patient with an indwelling urinary catheter. The nurse notes that the patient has developed urinary incontinence. What should the nurse do first? A. Reposition the catheter to ensure it is properly placed. B. Assess the patient for signs of a urinary tract infection (UTI). C. Increase the frequency of catheter care to prevent further incontinence. D. Notify the healthcare provider about the incontinence. Answer. B. Assess the patient for signs of a urinary tract infection (UTI). Rationale. The first priority is to assess for signs of a urinary tract infection (UTI). Option B, which could be the cause of urinary incontinence. Repositioning the catheter. Option A, and increasing catheter care. Option C, may help but are secondary to assessing for infection. Notifying the provider. Option D, may be necessary but follows after the assessment. 63. The nurse is caring for a patient who is receiving a blood transfusion and begins to experience chills and fever. What should the nurse do first? A. Stop the transfusion immediately and notify the healthcare provider. B. Administer acetaminophen to reduce the fever. C. Increase the rate of the transfusion to complete the procedure quickly. D. Apply a warm compress to the patient's back to relieve chills. Answer: A. Stop the transfusion immediately and notify the healthcare provider. Rationale: the first priority is to stop the transfusion immediately, option A, because the patient may be having a transfusion reaction. Administering acetaminophen, option B, or applying a warm compress, option D, may help alleviate symptoms but is not the immediate priority. Increasing the transfusion rate, option C, could worsen the reaction and is not appropriate. 64. A nurse is delegating tasks to a licensed practical nurse, LPN. Which of the following tasks can the LPN safely perform? A. Assessing the pain level of a post-operative patient. B. Administering oral medications to a stable patient. C. Providing patient education on smoking cessation. D. Performing a complete physical assessment of a newly admitted patient. Answer: B. Administering oral medications to a stable patient. Rationale: administering medications to stable patients, option B, is within the scope of practice for an LPN. Assessing pain levels, option A, providing patient education, option C, and performing a physical assessment, option D, require more advanced clinical judgment and should be performed by an RN. 65. The nurse is caring for a patient with a history of asthma who is experiencing wheezing and shortness of breath. What should the nurse do first? A. Administer the prescribed bronchodilator medication. B. Place the patient in a high Fowler's position to facilitate breathing. C. Obtain a peak flow measurement to assess airway function. D. Monitor the patient's oxygen saturation level and vital signs. Answer: D. Monitor the patient's oxygen saturation level and vital signs. Rationale: the first step is to monitor the patient's oxygen saturation level and vital signs, option D, to assess the severity of the asthma exacerbation. Administering bronchodilators, option A, and positioning the patient, option B, may help, but assessment should come first. Obtaining a peak flow measurement, option C, is helpful but should be secondary to monitoring oxygen status and vital signs. 66. A nurse is caring for a patient who has a new diagnosis of deep vein thrombosis, DVT. What should the nurse prioritize in patient education? A. Instruct the patient to avoid excessive physical activity to prevent clot dislodgement. B. Explain the importance of taking anticoagulant medications as prescribed. C. Teach the patient about the signs and symptoms of a stroke. D. Encourage the patient to wear compression stockings to reduce swelling. Answer: B. Explain the importance of taking anticoagulant medications as prescribed. Rationale: the priority in education for a patient with DVT is explaining the importance of taking anticoagulant medications as prescribed, option B, to prevent clot formation and complications. Instructing the patient to avoid excessive activity, option A, and wearing compression stockings, option D, are helpful but secondary to medication adherence. Teaching about stroke symptoms, option C, may be important, but it should follow after addressing anticoagulation. 67. A nurse is caring for a patient who is post-operative and complaining of pain. What is the nurse's first priority in managing the patient's pain? A. Administer the prescribed opioid analgesic. B. Assess the patient's pain level using a standardized pain scale. C. Apply a warm compress to the surgical site to promote comfort. D. Offer the patient non-pharmacological pain management strategies, such as deep breathing. Answer: B. Assess the patient's pain level using a standardized pain scale. Rationale: the first priority is to assess the patient's pain level using a standardized pain scale, option B, to understand the severity of the pain. Administering analgesics, option A, and offering non-pharmacological pain management, option D, are appropriate but follow the initial pain assessment. Applying a warm compress, option C, may help but is secondary to pain assessment. 68. A nurse is caring for a patient who is scheduled for surgery. The patient expresses anxiety about the procedure. What should the nurse do first? A. Administer an anxiolytic medication to reduce anxiety. B. Listen to the patient's concerns and provide emotional support. C. Reassure the patient that everything will be fine and the surgery is routine. D. Notify the healthcare provider about the patient's anxiety. Answer. B. Listen to the patient's concerns and provide emotional support. Rationale. The first priority is to listen to the patient's concerns and provide emotional support, option B, which can help alleviate anxiety. Administering anxiolytic medication, option A, may be appropriate but should follow after providing emotional support. Reassurance, option C, is important but should be accompanied by addressing the patient's concerns. Notifying the provider, option D, may be necessary but should follow after addressing the patient's emotional needs. 69. The nurse is caring for a patient who is receiving chemotherapy and has developed neutropenia. What should the nurse do first? A. Administer a white blood cell growth factor as prescribed. B. Place the patient on strict isolation to prevent infection. C. Monitor the patient's temperature every 4 hours. D. Assess the patient's wound sites for signs of infection. Answer. C. Monitor the patient's temperature every 4 hours. Rationale. The first priority in neutropenia is monitoring the patient's temperature regularly, option C, to detect signs of infection. Administering growth factors, option A, may be needed but is secondary to monitoring for infection. Placing the patient on isolation, option B, and assessing wound sites, option D, are important but come after temperature monitoring. 70. The nurse is caring for a patient who has just been diagnosed with a myocardial infarction, MI. What is the priority intervention? A. Administer oxygen to improve oxygenation. B. Administer morphine to reduce pain and anxiety. C. Obtain a 12-lead electrocardiogram, ECG, to assess heart function. D. Administer aspirin to inhibit platelet aggregation. Answer. A. Administer oxygen to improve oxygenation. Rationale. The priority intervention for a patient with a myocardial infarction, MI, is to administer oxygen, option A, to improve oxygenation to the heart, while administering morphine, option B, obtaining an ECG, option C, and giving aspirin, option D, are important. Oxygen administration is the first priority to prevent further myocardial damage. 71. The nurse is caring for a patient who is post-operative and at risk for bleeding. What should the nurse do first? A. Check the patient's coagulation status and monitor for signs of bleeding. B. Apply pressure to any incisions if bleeding is noted. C. Notify the healthcare provider about the risk of bleeding. D. Administer a blood transfusion as ordered. Answer. A. Check the patient's coagulation status and monitor for signs of bleeding. Rationale. The first priority is to check the patient's coagulation status and monitor for signs of bleeding, option A, to identify any early signs of hemorrhage. Applying pressure, option B, and notifying the healthcare provider, option C, may be necessary but should follow after initial assessment. Administering a blood transfusion, option D, would only be indicated if bleeding is confirmed. 72. A nurse is caring for a patient with a history of chronic obstructive pulmonary disease, COPD, who is receiving oxygen therapy. The patient is becoming increasingly confused. What should the nurse do first? A. Increase the oxygen flow rate to ensure adequate oxygenation. B. Assess the patient's oxygen saturation level and respiratory status. C. Notify the healthcare provider about the change in mental status. D. Administer a bronchodilator as prescribed. Answer. B. Assess the patient's oxygen saturation level and respiratory status. Rationale. The first priority is to assess the patient's oxygen saturation level and respiratory status, option B, because confusion can be a sign of hypoxia. Increasing the oxygen flow, option A, may be necessary but should be done after assessment. Notifying the provider, option C, and administering a bronchodilator, option D, can follow after assessing the patient's oxygenation. 73. A nurse is caring for a patient who is at risk for falls due to dizziness. What is the first action the nurse should take? A. Instruct the patient to use a walker when ambulating. B. Implement a fall risk protocol, including a bed alarm and non-slip footwear. C. Teach the patient to ask for assistance when standing or walking. D. Assess the patient's vital signs, especially orthostatic blood pressure. Answer. D. Assess the patient's vital signs, especially orthostatic blood pressure. Rationale. The first priority is to assess the patient's vital signs, especially orthostatic blood pressure, option D, to determine the cause of dizziness. Implementing a fall risk protocol, option B, and teaching the patient about fall prevention, option C, are important but should follow after the assessment. Instructing the patient to use a walker, option A, is helpful but not the first step. 74. The nurse is caring for a postoperative patient who is receiving opioid pain medication. The nurse notes that the patient is becoming drowsy and difficult to arouse. What should the nurse do first? A. Administer naloxone, Narcan, to reverse the opioid effects. B. Assess the patient's respiratory rate and oxygen saturation. C. Notify the healthcare provider about the patient's condition. D. Reduce the dose of the opioid medication and reassess the patient. Answer. B. Assess the patient's respiratory rate and oxygen saturation. Rationale. The first priority is to assess the patient's respiratory rate and oxygen saturation, option B, to determine if opioid-induced respiratory depression is occurring. Administering naloxone, option A, may be necessary if respiratory depression is confirmed, but assessment comes first. Notifying the provider, option C, can follow after assessment. Reducing the dose, option D, is not appropriate if the patient is already showing signs of overdose. 75. The nurse is caring for a patient who is postoperative and has a large wound. The nurse notes that the wound edges are not approximated. What should the nurse do first? A. Apply a dressing to the wound and monitor for signs of infection. B. Notify the healthcare provider about the wound status. C. Reposition the patient to relieve pressure on the wound. D. Assess the wound for additional signs of dehiscence or evisceration. Answer. D. Assess the wound for additional signs of dehiscence or evisceration. Rationale. The first priority is to assess the wound for additional signs of dehiscence or evisceration, option D, which are serious complications that may require immediate intervention. Applying a dressing, option A, and notifying the provider, option B, may be necessary but should follow the initial assessment. Repositioning the patient, option C, may help but is secondary to wound assessment. 76. A nurse is caring for a patient with diabetes who is experiencing signs of hypoglycemia. What should the nurse do first? A. Administer 15 grams of a fast-acting carbohydrate, such as juice or glucose tablets. B. Notify the healthcare provider about the patient's hypoglycemia. C. Assess the patient's blood glucose level to confirm hypoglycemia. D. Administer insulin to correct the blood glucose level. Answer. A. Administer 15 grams of a fast-acting carbohydrate, such as juice or glucose tablets. Rationale. The first priority in hypoglycemia is to administer 15 grams of a fast-acting carbohydrate, option A, to raise the blood glucose level quickly. Assessing blood glucose, option C, may be necessary but treatment should be given first. Notifying the provider, option B, and administering insulin, option D, are not appropriate for hypoglycemia and should not be done. 77. The nurse is caring for a patient with chronic kidney disease, CKD, who is experiencing decreased urine output. What should the nurse do first? A. Increase the fluid rate to improve urine output. B. Assess the patient's blood pressure and other vital signs. C. Notify the healthcare provider about the decreased urine output. D. Measure the patient's intake and output to monitor fluid status. Answer. B. Assess the patient's blood pressure and other vital signs. Rationale. The first priority is to assess the patient's blood pressure and other vital signs, option B, to determine the cause of decreased urine output, such as hypovolemia or renal dysfunction. Increasing the fluid rate, option A, and notifying the provider, option C, may be necessary but should be done after assessment. Measuring intake and output, option D, is important but secondary to the initial assessment. 78. A nurse is caring for a patient who has a history of heart failure and is experiencing shortness of breath. What should the nurse do first? A. Administer the prescribed diuretic to reduce fluid retention. B. Assess the patient's lung sounds and oxygen saturation. C. Increase the rate of oxygen administration to improve oxygenation. D. Notify the healthcare provider about the patient's symptoms. Answer. B. Assess the patient's lung sounds and oxygen saturation. Rationale. The first priority is to assess the patient's lung sounds and oxygen saturation, option B, to evaluate the severity of shortness of breath and identify any signs of pulmonary edema or hypoxia. Administering diuretics, option A, and increasing oxygen, option C, may be necessary but should follow the initial assessment. Notifying the provider, option D, can follow after assessment. 79. The nurse is caring for a patient who has just had a stroke and is unable to speak. What is the priority intervention? A. Provide the patient with a communication board to facilitate communication. B. Monitor the patient's neurological status for signs of further deterioration. C. Notify the healthcare provider immediately about the patient's inability to speak. D. Assist the patient with swallowing exercises to improve function. Answer. B. Monitor the patient's neurological status for signs of further deterioration. Rationale. The first priority is to monitor the patient's neurological status for signs of further deterioration, option B, following stroke. Providing a communication board, option A, and notifying the healthcare provider, option C, are important but secondary to monitoring for changes in neurological status. Assisting with swallowing exercises, option D, should not be the first intervention. 80. A nurse is caring for a patient with an indwelling catheter. The nurse notes that the catheter is draining blood-tinged urine. What should the nurse do first? A. Check the catheter for any kinks or obstructions that could impair drainage. B. Notify the healthcare provider about the presence of blood-tinged urine. C. Reassure the patient that blood-tinged urine is normal after catheterization. D. Monitor the patient's vital signs and assess for signs of shock. Answer. A. Check the catheter for any kinks or obstructions that could impair drainage. Rationale. The first priority is to check the catheter for any kinks or obstructions, option A, that may be causing blood-tinged urine. Notifying the provider, option B, and monitoring vital signs, option D, are important but follow after checking for a physical obstruction. Reassuring the patient, option C, without further investigation, may delay necessary intervention. 81. The nurse is caring for a patient with a history of asthma who is experiencing an acute exacerbation. What should the nurse do first? A. Administer the prescribed bronchodilator medication. B. Administer the prescribed corticosteroids. C. Assess the patient's oxygen saturation and respiratory status. D. Notify the healthcare provider about the patient's condition. Answer. C. Assess the patient's oxygen saturation and respiratory status. Rationale. The first priority is to assess the patient's oxygen saturation and respiratory status, option C, to determine the severity of the asthma exacerbation. Administering bronchodilators, option A, and corticosteroids, option B, may be necessary but assessment comes first. Notifying the provider, option D, can occur after the assessment. 82. A nurse is caring for a patient with heart failure who has developed worsening edema in the lower extremities. What should the nurse do first? A. Administer the prescribed diuretics to reduce fluid volume. B. Elevate the patient's legs to promote venous return. C. Assess the patient's lung sounds for signs of pulmonary congestion. D. Notify the healthcare provider about the worsening edema. Answer. C. Assess the patient's lung sounds for signs of pulmonary congestion. Rationale. The first priority is to assess the patient's lung sounds, option C, to determine if the edema is causing pulmonary congestion or worsening heart failure. Administering diuretics, option A, and elevating the legs, option B, may be necessary but should follow the assessment. Notifying the provider, option D, can be done after the assessment. 83. A nurse is caring for a postoperative patient who is at risk for developing a deep vein thrombosis, DVT. What should the nurse do first? A. Encourage the patient to perform leg exercises to improve circulation. B. Apply compression stockings as ordered. C. Assess the patient's legs for signs of swelling or pain. D. Administer prescribed anticoagulants to prevent clot formation. Answer. C. Assess the patient's legs for signs of swelling or pain. Rationale. The first priority is to assess the patient's legs for any signs of swelling, redness, or pain, option C, to identify early signs of DVT. Encouraging leg exercises, option A, and applying compression stockings, option B, may be part of prevention, but assessment should come first. Administering anticoagulants, option D, may be indicated after assessment. 84. The nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is experiencing shortness of breath. What should the nurse do first? A. Administer the prescribed bronchodilator medication. B. Assess the patient's oxygen saturation level and respiratory status. C. Increase the oxygen flow rate to improve oxygenation. D. Position the patient in a semi-Fowler's position to promote comfort. Answer. B. Assess the patient's oxygen saturation level and respiratory status. Rationale. The first priority is to assess the patient's oxygen saturation level and respiratory status, option B, to determine the severity of the shortness of breath. Administering bronchodilators, option A, and increasing the oxygen flow rate, option C, may be necessary but should be done after the assessment. Positioning the patient, option D, is helpful but not the first priority. 85. A nurse is caring for a patient who has just been admitted with a stroke. What should the nurse do first? A. Administer aspirin to reduce the risk of further clot formation. B. Assess the patient's neurological status using the Glasgow Coma Scale, GCS. C. Notify the healthcare provider about the patient's condition. D. Provide the patient with a communication board to facilitate speech. Answer. B. Assess the patient's neurological status using the Glasgow Coma Scale, GCS. Rationale. The first priority in a patient with a stroke is to assess the neurological status, option B, to determine the severity and potential complications. Administering aspirin, option A, may be done later, but the priority is assessment. Notifying the provider, option C, can follow after assessment. Providing a communication board, option D, is helpful, but assessment comes first. 86. A nurse is caring for a patient who is receiving heparin therapy and is at risk for bleeding. What should the nurse do first? A. Monitor the patient's platelet count and coagulation profile. B. Administer a vitamin K injection if signs of bleeding occur. C. Reassure the patient that bleeding risks are minimal with heparin therapy. D. Notify the healthcare provider about the patient's risk for bleeding. Answer. A. Monitor the patient's platelet count and coagulation profile. Rationale. The first priority is to monitor the patient's platelet count and coagulation profile, option A, to detect any early signs of bleeding or complications. Administering vitamin K, option B, is used for warfarin toxicity, not heparin. Reassuring the patient, option C, without monitoring is not appropriate. Notifying the provider, option D, can follow after monitoring. 87. A nurse is caring for a post-operative patient who is experiencing severe pain. The patient has a prescription for an opioid analgesic. What should the nurse do first? A. Administer the prescribed opioid analgesic as ordered. B. Assess the patient's pain level using a standardized pain scale. C. Notify the healthcare provider that the patient is experiencing severe pain. D. Administer a non-opioid analgesic for pain relief. Answer. B. Assess the patient's pain level using a standardized pain scale. Rationale. The first priority is to assess the patient's pain level using a standardized pain scale, option B, to determine the severity and provide appropriate intervention. Administering the opioid, option A, can be done after the assessment. Notifying the provider, option C, may be necessary if the pain is severe or unrelieved, but assessment comes first. Administering a non-opioid analgesic, option D, may be done but is secondary to the assessment. 88. The nurse is caring for a patient who is receiving chemotherapy and is at risk for infection. What is the first priority in infection prevention? A. Administer prescribed antibiotics as prophylaxis against infection. B. Place the patient in protective isolation to minimize exposure to infection. C. Assess the patient for any signs of infection, such as fever or chills. D. Encourage the patient to drink plenty of fluids to prevent dehydration. Answer. C. Assess the patient for any signs of infection, such as fever or chills. Rationale. The first priority is to assess the patient for any signs of infection, option C, such as fever, chills, or changes in vital signs. Administering antibiotics, option A, and placing the patient in isolation, option B, may be necessary but assessment comes first. Encouraging fluid intake, option D, is helpful for hydration but does not directly address infection prevention. 89. A nurse is caring for a patient with a history of hypertension who is experiencing chest pain. What should the nurse do first? A. Administer a nitroglycerin tablet as prescribed. B. Assess the patient's blood pressure and heart rate. C. Notify the healthcare provider immediately about the chest pain. D. Administer an opioid analgesic to relieve pain. Answer. B. Assess the patient's blood pressure and heart rate. Rationale. The first priority is to assess the patient's blood pressure and heart rate, option B, to determine the severity of the chest pain and identify any signs of myocardial ischemia or infarction. Administering nitroglycerin, option A, or analgesics, option D, may be necessary, but assessment comes first. Notifying the provider, option C, can occur after the assessment. 90. A nurse is caring for a patient who is post-operative and has a drain in place. The nurse notices that the drain is not draining any fluid. What should the nurse do first? A. Check for any kinks or obstructions in the drainage tubing. B. Notify the healthcare provider about the lack of drainage. C. Reposition the patient to facilitate drainage. D. Assess the patient's vital signs for any signs of infection or shock. Answer. A. Check for any kinks or obstructions in the drainage tubing. Rationale. The first priority is to check for any kinks or obstructions in the drainage tubing, option A, which could prevent proper drainage. Notifying the provider, option B, may be necessary if the problem persists, but the first action is to assess the tubing. Repositioning the patient, option C, and assessing vital signs, option D, can follow after checking for obstructions. 91. A nurse is caring for a patient who has developed a pressure ulcer. What should the nurse do first to promote healing? A. Administer prescribed antibiotics to prevent infection. B. Cleanse the wound using a non-alcoholic solution to prevent further tissue damage. C. Reposition the patient every 2 hours to relieve pressure on the ulcer. D. Apply a moist wound dressing to promote healing. Answer. C. Reposition the patient every 2 hours to relieve pressure on the ulcer. Rationale. The first priority is to reposition the patient every 2 hours, option C, to relieve pressure and prevent further tissue damage. Cleaning the wound, option B, and applying a dressing, option D, are important for wound care but come after addressing the pressure. Administering antibiotics, option A, may be necessary if infection is suspected, but pressure relief is the first priority. 92. The nurse is caring for a patient with a tracheostomy who is experiencing difficulty breathing. What should the nurse do first? A. Suction the patient's airway to clear any obstruction. B. Assess the patient's oxygen saturation and respiratory status. C. Notify the healthcare provider about the patient's difficulty breathing. D. Increase the oxygen flow rate to improve oxygenation. Answer. B. Assess the patient's oxygen saturation and respiratory status. Rationale. The first priority is to assess the patient's oxygen saturation and respiratory status, option B, to determine the cause of the difficulty breathing. Suctioning the airway, option A, and notifying the provider, option C, may be necessary, but they should follow after assessment. Increasing the oxygen flow rate, option D, may be appropriate, but it should be done after assessing the patient. 93. The nurse is caring for a patient with a nasogastric tube who has not been able to tolerate feedings. What should the nurse do first? A. Reposition the nasogastric tube to ensure proper placement. B. Assess the patient for signs of aspiration, such as coughing or difficulty breathing. C. Notify the healthcare provider about the intolerance to feedings. D. Slow the rate of the feeding and observe for improvement. Answer. B. Assess the patient for signs of aspiration, such as coughing or difficulty breathing. Rationale. The first priority is to assess the patient for signs of aspiration, option B, as aspiration can lead to serious complications like pneumonia. Repositioning the tube, option A, and notifying the provider, option C, can be done after assessment. Slowing the rate of feeding, option D, may help, but addressing aspiration risk is more urgent. 94. A nurse is caring for a post-operative patient who is showing signs of infection. What should the nurse do first? A. Administer prescribed antibiotics to treat the infection. B. Assess the patient's vital signs, including temperature. C. Notify the healthcare provider immediately about the infection. D. Apply warm compresses to the wound site to promote drainage. Answer. B. Assess the patient's vital signs, including temperature. Rationale. The first priority is to assess the patient's vital signs, especially temperature, option B, to confirm signs of infection and determine severity. Administering antibiotics, option A, and notifying the provider, option C, are necessary, but assessment comes first. Applying warm compresses, option D, may be done later, but it is not the first priority. 95. A nurse is caring for a patient who is at risk for falls. What should the nurse do first to prevent injury? A. Instruct the patient to call for assistance before ambulating. B. Implement a fall risk protocol, including non-slip footwear and a bed alarm. C. Reposition the patient every 2 hours to prevent pressure ulcers. D. Assess the patient's gait and strength before allowing them to ambulate. Answer. D. Assess the patient's gait and strength before allowing them to ambulate. Rationale. The first priority is to assess the patient's gait and strength, option D, to determine their ability to safely ambulate. Implementing fall protocols, option B, and repositioning the patient, option C, are important, but assessing the patient's ability to ambulate comes first. Instructing the patient to call for help, option A, is important but follows after the assessment. 96. The nurse is caring for a patient who has just returned from surgery and is receiving for pain medication. The nurse notes that the patient is becoming drowsy and difficult to arouse. What should the nurse do first? A. Administer naloxone Narcan to reverse the opioid effects. B. Assess the patient's respiratory rate and oxygen saturation level. C. Notify the healthcare provider about the patient's condition. D. Increase the flow rate to improve hydration. Answer. B. Assess the patient's respiratory rate and oxygen saturation level. Rationale. The first priority is to assess the patient's respiratory rate and oxygen saturation, option B, to determine if opioid-induced respiratory depression is present. Administering naloxone, option A, may be required, but assessment comes first. Notifying the provider, option C, and increasing the flow rate, option D, can follow after the assessment. 97. A nurse is caring for a patient who has just been diagnosed with diabetes mellitus. The nurse is providing teaching on blood glucose monitoring. What should the nurse teach the patient first? A. How to measure blood glucose using a glucometer. B. How to recognize signs and symptoms of hypoglycemia and hyperglycemia. C. The importance of maintaining a healthy diet and exercise routine. D. How to store insulin and administer it safely. Answer. A. How to measure blood glucose using a glucometer. Rationale. The first priority is to teach the patient how to measure blood glucose, option A, because accurate blood glucose monitoring is essential for diabetes management. Recognizing symptoms, option B, and teaching about diet and exercise, option C, are important but come after teaching self-monitoring. Storing insulin and administration, option D, is also crucial but follows after glucose monitoring. 98. A nurse is caring for a patient with a central venous catheter, CVC, who is complaining of chest pain. What should the nurse do first? A. Assess the patient's heart rate, blood pressure, and respiratory status. B. Remove the central venous catheter to prevent further complications. C. Notify the healthcare provider immediately about the chest pain. D. Administer oxygen as ordered to relieve the chest pain. Answer. A. Assess the patient's heart rate, blood pressure, and respiratory status. Rationale. The first priority is to assess the patient's heart rate, blood pressure, and respiratory status, option A, to determine the cause and severity of the chest pain. Removing the CVC, option B, may be necessary later if the pain is related to the catheter, but assessment comes first. Notifying the provider, option C, and administering oxygen, option D, can follow after assessment. 99. A nurse is caring for a patient who is receiving a blood transfusion and begins to experience chills and fever. What is the nurse's first action? A. Stop the transfusion and keep the line open with normal saline. B. Administer acetaminophen to reduce fever. C. Notify the healthcare provider immediately about the reaction. D. Apply a warm compress to the patient's hands and feet to improve circulation. Answer: A. Stop the transfusion and keep the foreline open with normal saline. Rationale: the first action is to stop the transfusion, option A, and keep the foreline open with normal saline to prevent further complications. Administering acetaminophen, option B, may help with symptoms, but stopping the transfusion is the priority. Notifying the provider, option C, and applying a warm compress, option D, can follow after stopping the transfusion. 100. The nurse is caring for a patient who is post-operative and has a large wound. The nurse notices that the wound is becoming increasingly red and swollen. What should the nurse do first? A. Notify the healthcare provider about the wound changes. B. Apply a sterile dressing to the wound and monitor for signs of infection. C. Assess the wound for signs of infection, including temperature and drainage. D. Administer prescribed antibiotics to prevent infection. Answer: C. Assess the wound for signs of infection, including temperature and drainage. Rationale: the first priority is to assess the wound for signs of infection, such as increased redness, swelling, temperature, or drainage, option C. Notifying the provider, option A, and applying a dressing, option B, are important but should follow the initial assessment. Administering antibiotics, option D, may be necessary but comes after assessing the wound. 101. The nurse is caring for a patient with diabetes who has a blood glucose level of 70 mg per deciliter and is exhibiting signs of hypoglycemia. What should the nurse do first? A. Administer a fast-acting carbohydrate, such as juice or glucose tablets. B. Notify the healthcare provider immediately. C. Check the patient's blood glucose again in 15 minutes. D. Administer insulin as prescribed to lower the blood glucose. Answer: A. Administer a fast-acting carbohydrate, such as juice or glucose tablets. Rationale: the first priority in hypoglycemia is to administer a fast-acting carbohydrate, option A, to raise the blood glucose level quickly. Notifying the provider, option B, is important but not the first action. Checking the glucose again, option C, should be done after administering carbohydrates, not before. Administering insulin, option D, would worsen hypoglycemia and is not appropriate. 102. A nurse is caring for a patient who is at risk for dehydration. What should the nurse do first to prevent dehydration? A. Offer the patient oral fluids every hour. B. Assess the patient's fluid balance by measuring intake and output. C. Notify the healthcare provider about the patient's dehydration risk. D. Administer 4 fluids as prescribed. Answer: B. Assess the patient's fluid balance by measuring intake and output. Rationale: the first priority is to assess the patient's fluid balance, option B, by measuring intake and output to determine the extent of dehydration. Offering oral fluids, option A, and administering 4 fluids, option D, may follow but are secondary to the assessment. Notifying the provider, option C, can be done after the assessment. 103. A nurse is caring for a patient who has a history of stroke and is at risk for aspiration. What is the nurse's first priority? A. Ensure the patient's head of bed is elevated during meals and medication administration. B. Assess the patient's swallowing ability using a formal swallowing test. C. Administer a thickened liquid diet as ordered. D. Notify the healthcare provider about the patient's aspiration risk. Answer: B. Assess the patient's swallowing ability using a formal swallowing test. Rationale: the first priority is to assess the patient's swallowing ability, option B, to identify any swallowing deficits. Elevating the head of the bed, option A, and administering a thickened diet, option C, are important for reducing aspiration risk, but should be based on the assessment. Notifying the provider, option D, may be necessary but is secondary to assessing swallowing ability. 104. A nurse is caring for a patient who is post-operative and has developed a fever. The nurse suspects the fever may be related to a wound infection. What should the nurse do first? A. Administer prescribed antibiotics to treat the infection. B. Assess the wound for signs of infection, including redness, swelling, and drainage. C. Reassure the patient that fever is a common post-operative finding. D. Notify the healthcare provider immediately about the suspected infection. Answer: B. Assess the wound for signs of infection, including redness, swelling, and drainage. Rationale. The first priority is to assess the wound for signs of infection, option B, as it is crucial to confirm the source of the fever. Administering antibiotics, option A, and notifying the provider, option D, may be necessary but should follow after the assessment. Reassuring the patient, option C, without further assessment is inappropriate. 105. The nurse is caring for a patient with a chest tube. The nurse notices that the water-sealed chamber of the chest drainage system has stopped bubbling. What should the nurse do first? A. Check the tubing for any kinks or obstructions. B. Notify the healthcare provider immediately. C. Increase the suction on the chest tube. D. Remove the chest tube and assess for any complications. Answer. A. Check the tubing for any kinks or obstructions. Rationale. The first action is to check the tubing for kinks or obstructions, option A, that may be causing the absence of bubbling. If the tubing is clear, notifying the provider, option B, may be necessary, but the priority is to troubleshoot the tubing. Increasing suction, option C, may not be required, and removing the chest tube, option D, is inappropriate without further assessment. 106. A nurse is caring for a patient who has been receiving a blood transfusion and begins to experience itching and a rash. What is the nurse's first priority? A. Stop the transfusion and assess the patient for other signs of a reaction. B. Administer diphenhydramine, Benadryl, as prescribed to relieve itching. C. Notify the healthcare provider immediately about the reaction. D. Apply a cool compress to the rash to relieve itching. Answer. A. Stop the transfusion and assess the patient for other signs of a reaction. Rationale. The first priority is to stop the transfusion, option A, and assess the patient for other signs of a transfusion reaction, such as difficulty breathing or chest pain. Administering diphenhydramine, option B, may be helpful, but stopping the transfusion is the priority. Notifying the provider, option C, is necessary but follows after stopping the transfusion. Applying a cool compress, option D, can be done after the transfusion is stopped. 107. A nurse is caring for a patient with a urinary catheter who is complaining of discomfort and is unable to void. What should the nurse do first? A. Check the catheter for kinks or obstructions. B. Reposition the patient to facilitate urine flow. C. Notify the healthcare provider about the patient's discomfort. D. Increase the fluids to promote urine output. Answer. A. Check the catheter for kinks or obstructions. Rationale. The first action is to check the catheter for kinks or obstructions, option A, as these may be causing the inability to void. Repositioning the patient, option B, may help, but it should follow after checking for catheter issues. Notifying the provider, option C, may be necessary if there are complications, but the first step is to check the catheter. Increasing fluids, option D, can be done after assessment if needed. 108. The nurse is caring for a patient who is recovering from surgery and is experiencing severe nausea and vomiting. What should the nurse do first? A. Administer prescribed antiemetic medication. B. Reposition the patient to prevent aspiration. C. Assess the patient's fluid balance and electrolytes. D. Notify the healthcare provider about the patient's symptoms. Answer. B. Reposition the patient to prevent aspiration. Rationale. The first priority is to reposition the patient to prevent aspiration, option B, as the patient is at risk for inhaling vomit. Administering antiemetics, option A, and assessing fluid balance, option C, are important, but the patient's safety comes first. Notifying the provider, option D, may be necessary, but it is secondary to ensuring the patient's airway is protected. 109. A nurse is caring for a postoperative patient who is at risk for hypovolemic shock. The nurse notes that the patient is becoming increasingly hypotensive and tachycardic. What should the nurse do first? A. Administer intravenous fluids as ordered. B. Increase the oxygen flow rate to improve oxygenation. C. Assess the patient's blood pressure and heart rate more frequently. D. Notify the healthcare provider immediately about the patient's condition. Answer. A. Administer intravenous fluids as ordered. Rationale. The first priority is to administer intravenous fluids, option A, to correct the hypovolemia and support circulation. Increasing oxygen flow, option B, may be necessary, but fluid resuscitation is more critical at this point. Frequent assessment, option C, and notifying the provider, option D, are necessary but secondary to fluid administration. 110. A nurse is caring for a patient with an arterial line. The nurse notes that the patient's blood pressure has dropped significantly. What should the nurse do first? A. Assess the patient's vital signs, including heart rate and oxygen saturation. B. Check the position and patency of the arterial line. C. Notify the healthcare provider immediately about the change in condition. D. Administer vasopressors to raise the blood pressure. Answer. B. Check the position and patency of the arterial line. Rationale. The first priority is to check the position and patency of the arterial line, option B, to ensure that the blood pressure reading is accurate. If the line is dislodged or blocked, it can result in inaccurate readings. Assessing the patient's vital signs, option A, is important, but it follows after verifying the line. Notifying the provider, option C, and administering vasopressors, option D, can be done later if necessary, but accurate monitoring comes first. 111. A nurse is caring for a patient who is at risk for developing a pressure ulcer. What should the nurse do first to prevent skin breakdown? A. Turn and reposition the patient every 2 hours. B. Apply a moisturizing lotion to the patient's skin. C. Assess the patient's skin for any signs of breakdown or redness. D. Keep the patient's bed in a high Fowler's position to reduce pressure. Answer. A. Turn and reposition the patient every 2 hours. Rationale. The first priority in preventing skin breakdown is to turn and reposition the patient every 2 hours, option A, to relieve pressure on vulnerable areas. Applying lotion, option B, is helpful but secondary to repositioning. Assessing the skin, option C, is important, but the primary intervention is turning the patient. Keeping the bed in a high Fowler's position, option D, is not ideal for preventing pressure ulcers and could increase risk. 112. A nurse is caring for a patient who is experiencing shortness of breath and has a history of chronic obstructive pulmonary disease, COPD. What should the nurse do first? A. Administer the bronchodilator as prescribed. B. Assess the patient's oxygen saturation level and respiratory status. C. Increase the oxygen flow rate to improve oxygenation. D. Notify the healthcare provider about the patient's condition. Answer. B. Assess the patient's oxygen saturation level and respiratory status. Rationale. The first priority is to assess the patient's oxygen saturation level and respiratory status, option B, to determine the severity of the shortness of breath. Administering bronchodilators, option A, and increasing the oxygen flow rate, option C, may be necessary, but assessment comes first. Notifying the provider, option D, is important but secondary to assessing the patient's condition. 113. The nurse is caring for a patient with a history of heart failure who is showing signs of fluid overload, such as swelling in the legs and difficulty breathing. What should the nurse do first? A. Administer diuretics as prescribed to promote fluid excretion. B. Assess the patient's lung sounds for signs of pulmonary edema. C. Reposition the patient to reduce the strain on the heart. D. Notify the healthcare provider about the patient's condition. Answer. B. Assess the patient's lung sounds for signs of pulmonary edema. Rationale. The first priority is to assess the patient's lung sounds, option B, to check for signs of pulmonary edema, which is a life-threatening complication of heart failure. Administering diuretics, option A, may be needed, but lung assessment comes first. Repositioning the patient, option C, can help comfort, but is not the priority. Notifying the provider, option D, is important, but should follow the assessment. 114. A nurse is caring for a postoperative patient who is at risk for developing deep vein thrombosis, DVT. What should the nurse do first? A. Encourage the patient to perform leg exercises to promote circulation. B. Apply compression stockings as ordered. C. Assess the patient for signs of DVT, such as swelling or pain in the legs. D. Notify the healthcare provider about the patient's DVT risk. Answer. C. Assess the patient for signs of DVT, such as swelling or pain in the legs. Rationale. The first priority is to assess the patient for signs of DVT, option C, as early detection is essential for preventing complications. Encouraging leg exercises, option A, and applying compression stockings, option B, are important, but they follow after assessment. Notifying the provider, option D, may be necessary, but it is secondary to assessment. 115. A nurse is caring for a patient who is receiving chemotherapy and is complaining of severe nausea. What should the nurse do first? A. Administer prescribed antiemetic medication. B. Assess the patient's nausea level and hydration status. C. Offer the patient a small meal to prevent further nausea. D. Notify the healthcare provider about the patient's symptoms. Answer. B. Assess the patient's nausea level and hydration status. Rationale. The first priority is to assess the patient's nausea level and hydration status, option B, to understand the severity of the symptoms and the risk for dehydration. Administering antiemetics, option A, is important but follows after assessment. Offering food, option C, may not be appropriate during severe nausea and could worsen symptoms. Notifying the provider, option D, may be necessary but assessment comes first. 116. A nurse is caring for a patient who is at risk for developing aspiration pneumonia. What should the nurse do first? A. Encourage the patient to cough and deep breathe regularly. B. Assess the patient's ability to swallow before administering food or liquids. C. Place the patient in a high Fowler's position during meals. D. Administer prescribed antibiotics as ordered to prevent infection. Answer. B. Assess the patient's ability to swallow before administering food or liquids. Rationale. The first priority is to assess the patient's ability to swallow, option B, to prevent aspiration. Encouraging coughing and deep breathing, option A, can help, but it is not the primary prevention strategy. Placing the patient in a high Fowler's position, option C, and administering antibiotics, option D, are important, but assessment should come first. 117. A nurse is caring for a patient who has just undergone a craniotomy. The patient's intracranial pressure, ICP, is rising. What should the nurse do first? A. Administer a diuretic to decrease intracranial pressure. B. Elevate the head of the bed to 30 degrees to reduce ICP. C. Monitor the patient's respiratory rate and oxygen saturation. D. Notify the healthcare provider immediately. Answer. B. Elevate the head of the bed to 30 degrees to reduce ICP. Rationale. The first priority is to elevate the head of the bed to 30 degrees, option B, to help reduce intracranial pressure. Administering diuretics, option A, may help, but positioning the patient comes first. Monitoring respiratory rate, option C, and notifying the provider, option D, are important but should follow after elevating the head. 118. The nurse is caring for a patient who has just been admitted with acute chest pain. What should the nurse do first? A. Administer oxygen as prescribed to increase oxygen supply. B. Obtain a 12-lead ECG to assess for signs of ischemia or infarction. C. Assess the patient's pain level and administer pain medication as needed. D. Notify the healthcare provider about the patient's condition. Answer. B. Obtain a 12-lead ECG to assess for signs of ischemia or infarction. Rationale. The first priority is to obtain a 12-lead ECG, option B, to determine if the chest pain is related to ischemia or infarction. Administering oxygen, option A, and pain medication, option C, may follow but should not be the first action. Notifying the provider, option D, is important, but it comes after assessment. 119. A nurse is caring for a patient who has been prescribed an antibiotic for an infection. The nurse notes that the patient is allergic to penicillin. What should the nurse do first? A. Administer the prescribed antibiotic and monitor for any reactions. B. Notify the healthcare provider immediately and request a change in medication. C. Administer an antihistamine to prevent allergic reactions. D. Apply a cool compress to the patient's skin to relieve itching. Answer. B. Notify the healthcare provider immediately and request a change in medication. Rationale. The first priority is to notify the healthcare provider, option B, about the allergy to penicillin and request a change in medication. Administering the antibiotic, option A, would put the patient at risk for an allergic reaction. Administering antihistamines, option C, and applying a cool compress, option D, can help with symptoms, but they are secondary to preventing the allergic reaction. 120. The nurse is caring for a patient who is receiving chemotherapy and is at risk for neutropenia. What should the nurse do first to prevent infection? A. Encourage the patient to practice frequent hand hygiene. B. Implement reverse isolation precautions to protect the patient from infections. C. Administer prescribed growth factors to stimulate white blood cell production. D. Monitor the patient's temperature frequently to detect early signs of infection. Answer. B. Implement reverse isolation precautions to protect the patient from infections. Rationale. The first priority is to implement reverse isolation precautions, option B, to protect the patient from infection, as they are at increased risk due to neutropenia. Encouraging hand hygiene, option A, and administering growth factors, option C, are helpful but secondary. Monitoring temperature, option D, is also important but comes after implementing isolation precautions.